If you are on Medicare here in Michigan, you need to pay attention. And honestly, even if you live elsewhere, this still may apply to you. Both Aetna and United Healthcare have announced major changes coming to their Medicare Advantage plans in 2026. I've already talked to several people who got letters saying that their plan is not being renewed next year, meaning that that specific plan will no longer be offered in their area. Now, that does not mean that Aetna or United Healthcare are completely gone from Michigan, but it does mean that some counties are losing plans and in others, benefits are being trimmed back. The problem is that a lot of people don't understand what their letters mean and they just think it's junk mail and toss it to the side. Then they find out in January that their coverage has ended or changed. Now, the annual enrollment period starts October 15th, and this is your time to review what's changing, compare your options, and make sure you're set up for 2026. Every year brings changes, but this year they are bigger than usual and you do not want to ignore it. So if you're in Michigan, please feel free to reach out and we'll review your plan together to make sure that you're set up for 2026. Now, with that being said, plans are changing nationwide and you don't want to be caught off guard going into 2026. I am also licensed in Indiana and Texas, so if you live there, I can also help you out. Follow along as we continue to break down Medicare.
People are tossing these letters thinking it's junk mail. Your healthcare is disappearing and you're throwing it in the trash next to pizza coupons. And honestly, can you blame them? The system is designed to be confusing. Tiny fonts, bureaucratic language, no clear action steps. It's almost like they want you to miss it, because when you don't respond, they win. You quietly lose coverage, no protest, no phone calls, no pushback. Just millions of people waking up in January with nothing, wondering what happened. If you're on Medicare Advantage anywhere, go read your mail. Tonight.
I am holding in my hand a letter from the Michigan Department of Health and Human Services that was addressed to my mother, who passed away in the end of November, around Thanksgiving time. Now, this letter was addressed to her, and she is, as I said, dead. And I had to pick it up from the hospice care facility that she was staying at, which is where it was addressed to in her name. And I thought maybe this was like a medical bill or something. I don't know. It was from the Department of Human Services, so it could have been anything, right? I was not expecting what this actually was, which was a notice telling her, my mother, that she's no longer eligible for healthcare coverage starting in January because she is now deceased.
A letter to a dead woman at a hospice, informing her she's losing coverage because she died. This is the system, everybody. They can't figure out who's alive, but they're real efficient at cutting benefits, aren't they? The bureaucracy can't update a single record, but sure, let's trust these people to restructure healthcare for 300 million Americans. This isn't just sad, it's a perfect snapshot of how broken everything is.
Yeah, okay, cool. What the fuck?
Last week, Republicans in the House of Representatives pushed through a budget plan that includes up to $2 trillion in cuts over the next decade. One of the biggest targets is Medicaid that could lose up to $880 billion in funding. If this happens, it means that states will be forced to slash benefits, kick people off the program, or both. Now let's talk about who this hurts the most. Low-income families, kids, seniors, and people with disabilities. What this means is that if you're on Medicaid, you could lose coverage. If you have family on Medicaid, they could lose essential health care, prescriptions, and long-term care. And even if you're not on Medicaid, this could flood hospitals with uninsured patients that would drive up ER costs and also insurance premiums for everyone. And it's not just Medicaid. This budget also guts public health funding. This would mean fewer resources for things like mental health programs, infectious disease response, and rural healthcare access. Now let's talk about where this proposed budget stands now. The House of Representatives barely passed this vote with a 217 to 215 vote, so now it's headed to the Senate.
217 to 215. 2 votes decided whether millions of people keep their health care. That's it. That's the margin between a kid getting cancer treatment and that same kid getting nothing. Between grandma keeping her medication and grandma rationing pills. And these same legislators approved corporate tax breaks unanimously. Money for billionaires? No debate needed. Money so your neighbor can see a doctor? Oh, we need to have a conversation about fiscal responsibility. The priorities are right there in the numbers. They're not even trying to hide it anymore.
If it passes there, the cuts will become real. What you can do is call your senators and urge them to vote no on this budget. You can find their contact info online by just looking up who is my senator and calling their office. Even leaving a quick voicemail makes a difference because lawmakers track these calls and pressure works. This budget is cruel, but it's avoidable and we need to stop it while we can. Let me know what you think about this in the comments down below and follow along for more public health content.
Hey, I want to talk about Medicaid cuts. You've probably heard a lot about Medicaid cuts from the federal level in D.C., and I want to talk a little bit about what's happening in Michigan and how we might be able to respond. So the governor put out a report saying how the Medicaid cuts could affect Michigan. There's 4 major types of cuts that are being looked at in Washington, D.C., changing provider taxes, changing the federal matching rate, changing how we do per capita caps, and maybe adding work requirements, which really just throws up roadblocks for people to prove they're working, even though the majority of Medicaid enrollees in Michigan are working. So, the Republicans here in Michigan actually already passed a budget on March 6th, House Bill 4161, which actually cut out every single dollar of Medicaid. So even though Speaker Pro Tem Rochelle Smith wrote a letter saying that House Republicans are in lockstep with the president and behind President Trump 100%, who is trying to make all these cuts through Congress, they actually went a step further than Mr. Trump. So congratulations, Michigan House Republicans. You cut 100% from Medicaid when the Republicans in D.C. are only trying to cut $880 billion.
Hold on. Washington said cut $880 billion, and Michigan's own House said amateurs and cut 100%. Every dollar gone. That's not a budget, that's an execution. You didn't trim fat, you removed the entire animal, and then wrote a letter bragging about it like it's an accomplishment. Your own constituents depend on this money, and you just zeroed it out like it was a rounding error. Incredible.
Well, holy shit. The Republicans just did something that, it's a bad look. It's a really bad look. Wait. So this comes from Occupy Democrats. So here we go. Breaking. Republicans get publicly shamed as brave protesters barge into a House committee hearing to oppose brutal cuts to Medicaid funding. So they're talking about cutting 13.7 million people to lose their medical coverage. The chair advises the audience that the violators will not be tolerated and the violators will be removed from the room and they may be subject to arrest. Are you ready to see who got arrested? They're all in wheelchairs. They're all handicapped. They are all in wheelchairs. And they went in. And wait. This is where they get arrested. They arrested handicapped people in wheelchairs. I can't. So there you have it. Republicans had people arrested who were in wheelchairs and not a threat at all.
They arrested people in wheelchairs, man. People who literally need Medicaid to survive showed up to say, please don't take my health care, and got put in handcuffs. What were they going to do? Roll menacingly at a senator? Same politicians who give speeches about freedom and standing up for your beliefs. Turns out that only applies if you can stand. If you're sitting in a wheelchair begging to keep your medication, that's a crime apparently. If this image doesn't bother you regardless of your politics,
the only threat to those people are Republicans. And you know what they say, when tyranny becomes law, rebellion becomes duty. If you want this shirt, it'll be linked right there. And as somebody who is disabled, this is terrifying. Please drop your comments.
Hey everyone, it's Eric Chung. I talked in my last video about these cuts to Medicaid. It looked like House Republicans might not go forward with some of the cuts, but this weekend, they did. Here's the scoop. The president's calling it a big, beautiful bill, but it doesn't look very big to me, and it certainly isn't beautiful. The bill moves forward on potentially more than $800 billion of cuts to Medicaid. There are 750,000 Michiganders who may be impacted and who may lose their coverage. These Michiganders include people with disabilities, children, elderly people, cancer patients, a lot of people who are good tax-paying citizens who just want their services as they were promised. House Republicans say they have to gut the programs because of a lot of fraud, waste, and abuse. Well, let's show the evidence first. Where is the fraud, waste, and abuse before we start cutting benefits for some of our most vulnerable people?
Well, folks, that new House budget, get ready because they plan on cutting the entire budget for Medicaid by $880 billion. Pretty much leaving anybody that's been on Medicaid, including children, the sick, elderly, whomever, without any form of insurance. Of course, this is to partially fund extending the Trump tax cuts permanently. So basically they're, taking away from the people who actually need that money to give to the billionaires. Big shocker there. They're going to try to implement new regulations for Medicaid and how to get it, but the amount of money is going to be drastically reduced, and thereby, having to drastically decrease the number of people enrolled in Medicaid that are actually receiving benefits. Oddly enough, it's people that live in red states that are going to be hit the hardest. Those are the people that receive the most amount of federal aid for things like Medicaid, for things like education, and so on. However, they still voted for the fucking orange bastard in the White House. Obviously because they didn't realize they were lied to. But, stupid is as stupid does, I guess. Anyway, hopefully some of those people will get their heads out of their ass soon enough and start raising a little hell. But I doubt it. But that's what's going on. Like I said, this is not just going to affect children and people who are disabled. This is also going to affect the elderly. Elderly people oftentimes have Medicaid as a supplement to their Medicare.
This is what people keep missing. Medicaid isn't just for poor people, it's the supplement that keeps elderly folks alive. Your grandma might have Medicare, but Medicaid covers what Medicare doesn't. The nursing home, the home aid, the prescriptions that cost more than her Social Security check. You cut Medicaid and suddenly Medicare alone isn't enough. Grandma's choosing between heart medication and eating, and nobody's checking on her now before the cuts. Imagine what happens after.
So your grandmother, your aunts, your uncle, your mom, your parents, they may have Medicaid as a supplement to their Medicare insurance. Not anymore if this goes through and it passes the Senate as well. I don't know how long it's going to take me to get this through y'all's fucking skulls, but Donald Trump doesn't give a shit about you. He never has. He never will. Like and follow for more.
If 17 million Americans lose access to basic life-saving care with cuts to Medicaid, it won't just hurt them and their families, it'll hurt us all. Within 10 years, Medicaid cuts would force the closure of over 300 U.S. hospitals. And no matter if you have insurance or not, if your hospital is closed, you're not going to get care when you need it the most. Destroying the system is not the answer. If we really want to make America healthy again, we must finally guarantee care to all Americans.
Ain't nobody checking on grandma now, as it is. Nobody's checking on grandma now, as it is. Nobody's going up to the nursing home, to the long-term care facility, making sure that their grandmothers and their grandfathers are okay now, as it is pre-Medicaid cuts. Nobody's checking on them now. You see what I'm saying? So, the fact that these cuts are coming and that they're correlating directly when the boomers are expected to hit the LTC markets.
With this federal bill that was signed into law on July 4th, Michigan is estimated to lose $6 billion. That's 1 in 4 Michiganders. 3 million Michiganders. If you're new here, please hit the follow button, share this video, save it, comment at least 5 relevant words, and then double tap to like this. St. Clair County's community mental health relies on 93% of Medicaid for their funding. These dollars directly support mental health, substance use disorder, developmental disability services.
93% of St. Clair County's mental health funding comes from Medicaid. 93. You cut that and people don't magically get better. They end up in emergency rooms, which costs more. They end up in jails, which costs more. They end up homeless, which costs more. They end up dead, and I guess that saves money. Maybe that's the plan. And the work requirements for people in rehab? Hey, I know you're fighting addiction, the hardest battle of your life, but did you clock your hours this week? No? Benefits cut. You're not saving money. You're just making suffering more expensive and moving the bill to a different department.
The federal cuts to Medicaid would mean that fewer people would be eligible for coverage, reduced coverage for those that are still covered. The increased pressure on local hospitals, jails, schools, and families, closures of hospitals that are reliant on Medicaid, especially in rural and remote areas like St. Clair County. The increased risk to women during pregnancy, childbirth, postpartum. Not only would this impact the individual who would lose the coverage, it would impact all of their staff, healthcare providers, the entire social safety net of the vulnerable community.
The MDHHS annual budget is about $37 billion. 74% of that is just Medicaid, $26.8 billion. When you take all of that federal funding out, our state's portion is only about $8.4 billion. So the state is unlikely to be able to fill in those gaps. Where are we going to find $27 billion? So my question to John James and Lisa McClain is, what is your solution to all of these cuts to your constituents? The work requirement for those between the ages of 19 to 64 for able bodies. But what about those dealing with mental health and substance use abuse who have to go in for treatment? And maybe that treatment might take a day. It might take 3 days. It might take 2 weeks. It could take months. Some of them relapse and then they have to go back. So are you expecting them to still be able to work so that they can get their coverage, to be able to get their treatment? I want to take a moment to thank everybody who works in the community mental health space. Thank you for all the work that you do to take care of our most vulnerable population. Your work and your effort and your dedication does not go unnoticed.
So a poll just came out and it showed that almost 80% of Americans polled want to see the Affordable Care Act tax credits extended. This is something that makes healthcare more affordable, especially for the self-employed and those at lower income levels as well. But also the Affordable Care Act, as many know, it actually prevented you from being discriminated against for having a pre-existing condition. Formerly, that was the case. They could discriminate against you for having diabetes or something else. Anything, really. Another interesting fact about this poll from KFF was they found that out of the Republicans that were polled, they found that 57% who identified themselves as Donald Trump supporting MAGA Republicans wanted to see these tax credits extended. So I guess we're going to find out how much these voters are going to be represented when we find out if these tax credits for the Affordable Care Act will be extended. What do you think? Do you want to see these Affordable Care Act tax credits get extended, or do you care? Now, another factor in this is the Medicaid cuts. If we want to consider that hospitals depend heavily on Medicaid funding, if they're not going to be compensated at the same amount of money, hospitals are set to close in some areas. Not only this, if they don't close, they may have to raise their prices just to stay open if Medicaid cuts go through and continue to go through. And what that means is, if they depend on that Medicaid funding, as most hospitals do, they will have to raise prices on their services at that hospital in order to make up for those cuts to their funding. Now, what does that mean for you? Even if you're not part of the healthcare marketplace, that means that these hospitals are likely to have to raise their prices. The health insurance companies are going to have to pay higher prices if the hospitals raise their prices because they have to pay the bill. And then what happens there? Well, those health insurance companies, are they going to lose that money? No, they're going to have to find a way to get their profits back. And how will they do that? Well, they only have a couple options. One of them is increasing denials. Another way to retain more profit is to raise health insurance prices. What do you think?
Here's the domino nobody talks about. Hospitals lose Medicaid funding, so they either close, meaning you're driving an extra hour to the ER when your kid breaks their arm, or they raise prices to survive. Insurance companies pay more. They deny more claims. They raise your premiums. You thought this wouldn't touch you because you have good insurance through your job? Surprise, your premiums are going up, your deductible is going up, and your insurance company is finding even more creative ways to say no. You're cheering because your neighbor's side of the boat is sinking. Bro, you're in the same boat.
Anybody who has spent time in a hospital knows that doctors are very important, but that nurses are the people that take care of you. Since early January, 15,000 nurses across our city, at Mount Sinai, at Columbia Presbyterian, at Montefiore in the Bronx, have been striking, have been fighting not only for their self, but for their patients. They have been waging a war against wildly overpaid hospital execs who earn millions and millions of dollars every year, and billionaire board members who are trying to gut this union, who are trying to strip these nurses of their own health care, who are trying to roll back hard fought for safe staffing ratios. These nurses are fighting to keep ICE out of the hospitals and fighting for the health care of our trans youth. It is time for those super wealthy people to come to the table and give the nurses what they are owed. And lastly, a message to Kathy Hochul, our first New York State female governor. This is a union that is overwhelmingly female, overwhelmingly people of color. It is time for you to put a little muscle into this and to help support those nurses, those people who keep our city safe and healthy.
You can change American healthcare just with the choices that you make as a patient. I saw patients in clinic today who shared their stories and made a difference for others. Rachel, who you've heard about, had her surgery at a hospital that wasn't prepared for her, and then she shared her story online. And that helped other insurers to make different decisions and to allow their patients to have surgery at Redbud. I shared that with her today, and you could see how proud she was that even though it was really hard for her, sharing that story made a difference. And then I met with another patient who 4 months ago had her deep flap here at Redbud. She's doing so great, and she was here today to talk about whether we're going to do a surgery on the other breast to kind of balance things. So when we initially did her surgery 4 months ago, we had to go through all of these hoops to get a special permission to have approval to do her surgery. And today, her insurance has decided to make Redbud in network after that experience. So Cigna is now in network with Redbud, and this patient who trusted us, who went out on a limb and said, I think that you can do better for me there than at a hospital. And we did it. She helped pave the way for all of the other patients with Cigna to have their surgeries here at Redbud too. So the choices you make, choosing to do things differently, will move the needle and change American healthcare. Thank you.
Letters to dead people. Wheelchair arrests. $880 billion gone. And the people getting hurt the most? They never saw it coming. This isn't left versus right anymore. When hospitals close and premiums skyrocket, that wave hits everyone. Call your senators, make noise. They're counting on your silence. Share this, subscribe, and for the love of everything, read your mail. This has been Mind Mirror. Stay sharp, stay loud.